Hi, my name is Greg Felt. I'm Director of Public Health. This is a situation report of today, the 7th of June, and a bit of a forward look. So epidemiology-wise, a 7-day rate is below 30 per 100,000 and has been trending down, quite slowly trending down for quite a long time now. R is probably about 1, maybe just a bit below, maybe just a bit above, but there or thereabouts. The rates in the elderly continue to come down, and the most likely to be infected group now are the 0 to 18s and the early working age. They're out and about most, out at school, out at work, and are the least vaccinated. Probably that group are infected, not enough to affect the overall position of the city, but we do need to be careful. We're 2 weeks now into step 3 of the roadmap, and increasingly eyes are turning towards step 4 of the roadmap when we get our freedoms back. What's clouding that a little bit is variants of concern, and I'm uncertain where the government will go as of step 4 of the roadmap. The interface between variants of concern and the roadmap is difficult. Many epidemiologists are now being a bit gloomier. Last week's Public Health England epidemiology update was a bit gloomy in that there is higher transmissibility of the Delta variant and probably higher harm from the Delta variant. So we need to be careful here going forward. Essentially, it's a race between the spread of the variants of concern and the vaccination. It's fair to say that the step 3 of the roadmap hasn't had the impact that I thought it would have yet. In Sheffield, and the Delta variant isn't yet an issue in Sheffield, but I think both of those predictions will be that the Delta variant will spread in Sheffield, and I think the rates will go up. So looking forward to the roadmap, it's really impossible to say what might happen in the government's considerations coming up to the step 4 of the roadmap. I think all options will be on the table, and it's not for me to second guess what they might be. So the ask of individuals and for businesses is we want to keep Sheffield open. We want to keep Sheffield on the path it's currently on. Currently it's on a pretty good path. Vaccination will reduce hospitalisation and death. It isn't 100% effective. And for those that aren't yet fully vaccinated, we still need to take care to prevent infection. There's always the prospect of long COVID, and there was a very thought-provoking piece from the Office of National Statistics on the prevalence and the impact of long COVID published last week. It was very, very sobering. So I think we will get into step 4. As we get there, we'll face a further wave of COVID infections. The things that we can be certain will reduce the size and harm of that episode will be effective isolation in people with the illness who test positive. Effective home testing probably will make a difference. Increasing the proportion of us who are doubly vaccinated, i.e. have had both doses, and we're still a good way off there, so we're pushing quite hard on that one. And wearing face masks and things indoors, particularly with non-household members, and increasing ventilation where possible, will also make a difference. Things that will make recovery slower: ignoring symptoms, not isolating, not getting tested, unmasking in crowded, poorly ventilated spaces, and being delays in vaccination will all prevent and slow our recovery. So it's in all of our interest to keep spread low. Step 3, moving to step 4 and then beyond. That protects individuals, it protects the economy. I get that this is all a bit disheartening. I get that we all want it to be over. I do. We can't alter the virus, but we can alter the outcome of the virus depending on how we behave. And it's important that you can try and steer the path between perpetual lockdown versus just letting the virus rip through the as yet unvaccinated people. Will remain in that space for the remainder of the summer. So on vaccination, Sheffield is increasingly well vaccinated, which is great news. As of last week, there were about 322,000 people that had the first dose and 213,000 people that were fully vaccinated. We're trying hard to bring forward second doses at this moment, and of course that's brilliant news. We need to continue that progress, particularly as we see new variants emerge. The only way to help stop the spread is to be fully vaccinated with both doses. It's really important that you have both doses. In England, People aged 30 or more are now eligible for a vaccination. Please book today. Get the jab, help stop the spread. And it's important to remember that even when you're fully vaccinated, you can still catch COVID, but you just won't be as poorly. You're not invincible. We hear lots of stories that people feel bulletproof once they're vaccinated and don't need to test twice a week, and can go and do whatever they want, whenever they want, even if they've got symptoms. You still need to follow the guidance, and I'm sorry to have to say that, but it's important that we do all we can to reduce the spread. Being vaccinated is part of that, following the guidance is the other part of that. We can't take our eye off the ball now. Things are going reasonably well. Don't know how long that will remain. But even if you're fully vaccinated, you can still acquire COVID, catch it, and you can still pass it on to others. So it's important that we still follow all the rules. So on reporting tests, it's great to see that lots of people are using lateral flow device tests for asymptomatic testing. However, it's critical that the results are reported. It's a really quick online process. You can go to the online website gov.uk, report COVID-19 result. You can also do it by phone, and the numbers are on the pack. Many people aren't reporting the test results, positive or negative, and that kind of leaves us in the dark a little bit, actually. So reporting the results helps us reduce infection rates in the community by knowing what's going on where, and that in turn helps us keep Sheffield open. I appreciate that big families, it can be quite a long process, particularly if you have to report several results, but it's really important that we do this to know where the virus is and to control the spread. Remember, do not use lateral flow device tests if you've got symptoms. If you develop symptoms, book a test at a testing site as soon as possible and self-isolate for the full duration if you test positive. And again, please don't visit your GP or pharmacy if you have symptoms that you think are coronavirus.